It's Central Valley Business. I am your host, Steve Walling, and my guests for this segment are Jerry and Anna from Emerging Health. Welcome to the show.
Thank you.
I'm glad to have you back. We had you folks on once before with me and maybe in the other business show. But I want to take a moment and let's talk about Emerging Health, the organization itself, because when you shared that last time, I thought, what an incredible service that you're bringing and what you do. So tell us a little bit about it.
Well, Emerging Health was founded by Dan Trejo, who has a physical disability, and his wife worked in mental health for many years, and he volunteered with her, and he noticed that a lot of the mental health clients and consumers were kind of just needed to be energized. They were just kind of sitting there. A lot of times people get a diagnosis and they just kind of give into their symptoms, or they just take their medications and they're just there. Well, he saw that they needed to do something, to build up that self-esteem again. And so he started Emerging Health and to kind of empower and motivate a lot of the clients, and it's been very successful.
Now, how long has this been going
on? He started in April of 2005.
Okay, so you've got 10 years under your belt, and you've got a location. Now, you told me you call it the studio.
Yes, it's called the studio.
But it's like your offices, and what else does it do? You've got, Jerry, you were saying that there's other things that go on there besides office work.
Yes, we offer support groups, peer support groups, and we also we basically work with the humanities, arts and humanities. And it's so we do beading and we do painting and we audition for musical talent for our shows.
Creative activities, basically, for individuals. And the individuals that are going to be experiencing this have, like you were saying, they've been given a diagnosis, they maybe closed down around themselves. Life all of a sudden went from, well, maybe it wasn't great, but now it really isn't great, and they've got a place to turn to in Emerging Health. They come in, and you've got the various support groups and stuff, and you've got the activities. What a great thing! Now, how do I find you?
We're at 1617 West Shaw, and we also have, I think they put our blog, emerginghealthnonprofit.wordpress.com, and we have all our information, any upcoming shows or different venues that we're in, that we do. We recently had a Dream and Nightmare event where we had our dream doctor, Dr. Dennis Lewis, who is also on our board of directors, go and speak with people who suffer from nightmares and offer some kind of help. And it was a free event, and we try to do this to try to help you, because a lot of our mental health consumers do suffer from such things. So it's another way to try to help them. It's not all medical modeled as some of the places out there, like here, take a pill, you're okay. Trying to work with them more with their brains and teaching them a healthier way to
empowering them to empower themselves.
Exactly.
That's a great thing. And you mentioned shows. Tell us about the shows.
Well, we have we do 4 a year, and they're support groups. Excuse me. They're fundraisers, but with a dinner also. So it's dinner and the show. And
dinner and a show.
Yeah, exactly. So it also has not only the comedy show, but we also do music. We have people singing and things like that. And everybody that's involved are all volunteers. There's no paid staff or anything. Anybody who's involved in the show is also either a mental health consumer themselves or a family member of. So it's all one big support system going on, and everybody does raffles and all kinds of things that we do at the show as well. So everybody has a good time.
Yeah, that's wonderful.
Yeah. And
so you got a show coming up?
Yes, we have one.
June 20th.
June 20th.
Tell me about it.
Exactly. Well, June 20th we'll come out at the Park Inn, which is the corner of Dakota and Blackstone's, the old Smuggler's Inn. Okay. In the Crystal Ballroom there, and we'll have the dinner and the show, and it's just a time for people to come out. A lot of our sponsors, they'll either sponsor the show, maybe they can't come, but that money goes to tickets for mental health consumers, so they can attend the show, because sometimes that's the only thing that they get to go out and do.
So, okay, not only is it a fundraiser, but it is a venue for the mental health consumer themselves
exactly.
to get out. and they can get out in an environment that's safe.
Exactly.
And have a good meal and entertainment.
Right, and it's a really nice meal. I mean, it's like really fancy, not to have anything against fast food, but it's not like a fast food. It's like a really nice place settings. Everything's
it's
very
not just a little dry
elegant.
burger and
no,
stale fries, huh?
not at all.
Really?
It's very elegant. It's very nice. It's just a really nice environment.
Well, that's great. Doesn't get any better than that.
No.
And again, you've been doing this for how many years?
I was diagnosed in 2008. Emerging Health was in 2005.
Yeah.
So I kind of came in right in there. I started working with them in 2009, volunteering my services because I'm one of the humorologists, and I'm also on the board of directors with Jerry as well.
All right. What is a humorologist?
A humorologist, that's a fancy word for an unpaid, unprofessional comedian.
Okay. Well, that's cool. Now Jerry plays a harmonica.
Yes,
but he's in the process of becoming a humorologist. Is that?
I would like him to.
Yeah?
Yes.
All right, good. And you've been on the board. How long have you been on the board, Jerry?
It's been probably like 6 months now.
About 6 months?
I'm fairly new. Yes.
Okay. It's got to be a challenge, though, doesn't it? Working with it. Gratifying, but still, you've got so many different things so many different areas that you've got to look at and move through.
Exactly, but it can be a challenge if we look at it as that.
Okay.
But I always try to look at it in a positive way, that we're helping another person. Volunteer. There's a saying about volunteers: they don't get paid because volunteering is priceless. What we do is priceless.
The consumer that would come to you, how do they find out about you? How is it just kind of word of mouth or doctor's offices? How do they find out?
Right now, it's a lot of word of mouth. A lot of people, in the community, a lot of times people find out very quickly.
Right.
We know other organizations and other nonprofits that have, sent people to our nonprofit. So it's just working in that community, working together for resources.
Okay. So if you happen to know someone out there that has some type of mental challenge in their life of some sort, this is a place. You can connect them with that, and if you happen to have June 20th open, well, even if you don't, show up. Just like I said before, these things in our community here in Fresno, it doesn't get any better than our people doing for our people.
Right.
And that's a great thing, and we got to support it.
Right.
We got to see it grow, we got to see it expand, and we got to see it just blossom because we've got, I don't know what the population is here now, but we have a significant part of that population that doesn't know about you, that doesn't know what you do, but could very greatly use the services you provide. Exactly. So we need to get the word out, and we need to support you. Right. And the way to do that is to go to these 4 shows a year and find ways to just word of mouth, talk to your neighbor.
Right.
Bring it to your church, your whatever.
Or visit the studio.
Yeah.
And go there and get some more information. I believe that he also put the telephone number there to call. They can call for more information as well.
What's the telephone number?
I do not know his number by heart. It's written right there.
Phone number here is 529-7782. Look them up on the internet. Go to the studio, and on June 20th, be there at the Park Inn for this wonderful, powerful, supportive fundraiser.
Right.
And thank you very much for being on the show.
Thank you for having us.
Jerry?
Thank you so much, Steve.
You are so welcome. Y'all have a great day, have a great fundraiser, and we'll be seeing you again soon.
Thank you.
All right. We'll see you when we come back.